take a look at another example when dealing with averages, okay? Mean, median, mode, central tendency. Let's take a look at the recovery times from two surgeons. So let's look at the following data. These are the recovery times in months for several patients after a knee surgery with two different doctors. How would you use this data to decide who you would choose as your knee surgeon? So we have Dr. Wong, and there are 12 different patients that he has given a knee surgery to, and their recovery times. Dr. Bernard, on the other hand, also has 12 different patients and how long they have taken to recover. Let's take a look at the measures of central tendency. Okay. So to start with, we're going to start with Dr. Wong. Okay. Now, we could calculate these up, and for the sake of time, I'm going to just do them very quickly here. The first one, mu for Dr. Wong is 19 months. So that is the average. So if we calculate out the average, it's 19 months. The median is 19.5 months. Mode, so most common one, is 16 or 24 months. Okay. So there's Dr. Wong. There's the data on Dr. Wong. So I've given you the data, and so we to calculate the mean, median, mode. You can do the same thing, put them all in order. Okay, add them up, determine the average or the mean. Find the middle one. That's the median. The mode's going to be the most common. It's 16 and 24. There's two of each. Let's look at Dr. Bernard. Dr. Bernard, on the other hand, has some different data. So we're going to start off with our mean, or mu. And his mu is 18.75 months. Okay, the median is 18.5 months. And the mode is equal to 18 months. Okay. So this is our mean, median, mode for Dr. Bernard. Now, if we compare them, we look and see that Dr. Bernard has a slightly lower mean. Okay, that means that Dr. Bernard's patients, on average, okay, and this is the mean, will recover a little bit quicker than Dr. Wong's patients, not by much. Okay, 1 week, 0.25 a month. It's like 1 week. The median, on the other hand, really pulls for Dr. Bernard. Okay, it shows that there's that 18.5 months. Okay, which means that it's about a month quicker as the median. Okay, that means that half of Dr. Bernard's patients are healed a month quicker than Dr. Wong's. Okay, or at least that's where the median is. Now the mode, on the other hand, we have a mode of 16 or 24 for Dr. Wong and only 18 for Dr. Bernard. Okay, there was 4 18s in there. There's a couple 20s, a couple 21s, but there was a lot of 18s. So the mode or median is kind of in between the two medians for Dr. Wong. Now, which doctor are you going to go to when it comes to your knee surgery and the recovery times? Well, let's take a look at Dr. Wong. He's got someone who recovered in 10 months and in 13 months. That's pretty quick. Okay, that means that in roughly about a year or just under a year, you could be recovered from a surgery. Now, again, there's other things that come to play with that, but that's pretty good. But he also has someone that took 26 months. That's like over 2 years to recover. And a couple of people at 24 months, there's 2 at 24. Okay, Dr. Wong has a wide range of data. Okay, he's got a wide range of data. Dr. Bernard, on the other hand, if you look at it, everybody is between 16 and 21 months. 21 is the most, 16 is the least. He is very consistent, or at least his patients are very consistent in the amount of time it takes him to recover. This could be something that we look at when we talk about which doctor we should go to. Okay, each one of those measures of central tendency comes into play when we talk about which one is better. Okay, but we can also see Dr. Bernard's are very consistent. Dr. Wong's are wide range. We could heal really quickly, 10 months, or we could take a long time, 26 months. Now, again, this data only tells us one little factor or one piece of data as to how long it takes someone to recover. We don't know a lot of other things. And there's a lot of other pieces of data that we could put in here, okay, or a bunch of other things that come into play here. You know what? There is the metabolism / athleticism / health of the patients. Okay, which one? Who's in athleticism? Athleticism. Okay, all those come into play, right? If you have someone that's super healthy and they have a really good metabolism, they have really good health, they're probably going to heal because their bodies are actually built to heal better. Look at professional athletes. They heal really quickly compared to the average person. Okay? Age comes into effect. Okay? Age is a big thing. I'm not overly old yet, but it would take me a lot longer to recover from something than it would you because you are a lot younger. Okay, it makes a big difference. Age makes a big difference. Okay, physiotherapy. Okay? Physiotherapy makes a big difference as well. How are you training that knee? How are you improving that knee? Are you doing anything, or are you just letting it sit and heal? Physiotherapy does make a big difference. And extent of injury can also really play into it. Okay, extent of injury plays into it. All these things affect how long it's going to take to recover. These numbers don't mean anything if we don't have some background information, but they can tell us a story of what is going on. And so it does help to look at the numbers as well.